Now, Bernie Sanders has released his long-awaited Medicare for All program, which now has a total of 16 co-sponsors. Now, that's the most this bill has ever had. Now, recently, Jeanne Shaheen today came out as a co-sponsor, and Al Franken came out yesterday. So that's awesome. Again, unprecedented support for this piece of legislation. Now, the plan, as expected, will create a universal Medicare program that covers everybody under one government-sponsored insurance plan. Now, let me break down what that means, because single payer means different things for different people. Okay, so let me break down what the Sanders plan would actually do. Now, single payer, of course, just means, because right now we're in a multi-payer system. Now, instead of having those multiple payers, for example, health insurance companies and programs like Medicaid stepping in to pay hospitals and doctors, there would literally be one payer. They would be all replaced with the government and a program called Medicare. It would just simply, you go to the doctor, you present your insurance card or your Medicare for All card. Everybody gets one. And then, oh, look at that. You're covered. Fairly simple. Okay. Now, that doesn't mean that the government would pick your doctors. It would just mean that doctors and hospitals would be paid by the government instead of the insurance companies. Okay. And not only that, but there would be no out-of-pocket costs for people who have this insurance, which would be everybody. Okay. No out-of-pocket costs, no co-payments or deductibles. Now, what this bill also does is that it would bar employers from offering separate competing plans. Now, that makes sense because they wouldn't need to. There wouldn't be a need for separate plans. Everybody would be covered. Now, that's actually beneficial for small businesses because they would not be forced to cover their employees. All right. So now the rollout, how this would work is over the next 4 years, they would gradually get people into the program. Now, in the first year, people under 18, they would be enrolled, and those under their employers' plans would be able to take those 4 years to transition over to that system, or they would have the option to buy into Medicare almost immediately. So that's interesting. Now, what would it cover? It pretty much covers everything. Well, let's be honest about that. Hospital visits, primary care, medical devices, lab services, maternity care, prescription drugs for the most part, and not only that, but vision and dental. So this is very, very comprehensive. And actually, this system is far more generous than some of the other countries. For example, Canada, right? Now, that would ensure that America has the best #1 healthcare in the world. Now, again, Canada, right? I made that comparison. Canada's system right now is more progressive, but they do lack a lot of things. They don't cover vision, they don't cover dental, and they don't cover, for example, in-home elderly care, right? So I have a personal friend that had to take care of his father, who is a Canadian. They do not help with that. The government doesn't help. Medicare, under the Sanders plan, actually would pay for that stuff. So, again, super progressive, okay? Now, one thing this plan does not cover is stuff like plastic surgery. So, for those of you like, oh my God, they're going to go and get anything that they want in this healthcare plan. They're going to go and actually use their healthcare. And they're going to waste our money on things like boob jobs. You're not getting boob jobs on this plan. They actually say that you have to get a supplemental insurance plan to get those optional surgeries, like breast augmentations or whatever. So, and that's again if you want it. What this does is it covers the essentials. There will be some out-of-pocket costs for prescription drugs. However, if you allow Medicare to negotiate drug prices, which is would be a separate piece of legislation, as well as import cheaper drugs from Canada, again, a separate piece of legislation to go along with this, that would vastly lower the costs for some prescription drugs, the ones that are still that will still be paid for out of pocket. Okay. Now, does this mean, what does this mean? You will end up paying a little bit more in taxes, but at the end, you will actually get more back in the long run, and actually will save more money in the long run. Now, it's because there are measures in this bill that will reduce the overall cost for the country, and I'm going to go through that. This is Sarah Cliff from Vox, and she explains that for one, moving all Americans to one healthcare plan would reduce the administrative waste in our healthcare system in the long run. And that's true. According to the Center for Economic Policy Research, private health insurance right now, their companies have an overhead of around 12%. So that's 12% just wasted on administrative costs. Now, government-run plans, however, like public Medicare, that does not count private Medicare supplement plans, have an overhead of 1.8%. And by the way, those Medicare supplement plans, those actually have an overhead of 18%. So, damn, that's super amount of overhead. And it's because these private companies are coming in and they're getting public dollars. So, like, let's increase our overhead costs because it's free money. So this bill, of course, would clamp down on that. Now, there's also an article back in 2003 in the New England Journal of Medicine that estimated that the United States spends twice as much on administrative costs as Canada. Now, Canada, again, that has a single-payer system. So, as you can see, single-payer is much more efficient than private insurance. And one of the reasons is obvious, it's profit motive. Now, it doesn't have that big of an effect, to be honest with you, because insurance company profits are about 3.2%. Nonetheless, the difference still is stark. The government doesn't have a profit motive, but private insurance does. That will increase your costs. Again, 1.8% overhead versus 12%. That's a big difference. Now, the government also, under this plan, wouldn't need to advertise. And the government already doesn't advertise. That's why some of that is so low. And that's why private insurance plan overhead is so high. A lot of that money goes into commercials to try to compete. Okay, so again, that makes it inefficient. Now, another cost to our current system is that doctors spend a lot of time and money having to argue and deal with insurance companies. In fact, Cliff writes, they each negotiate their own rate with every hospital and doctor. An appendectomy, for example, can cost anywhere from $1,529 to $186,955, depending on how good of a deal an insurer can get from a hospital. Not only that, but there was a 2011 study in the Journal of Health Affairs that estimated that American doctors spend about four times as much time dealing with insurance companies as compared with, again, Canada. So you've got these doctors that are wasting their time and their effort just negotiating with insurance companies instead of being doctors. You ever wonder why you can't see your doctor? It's because he's usually on the phone with your health insurance company saying, no, we need to cover this test or we need to cover this treatment. And it's actually not spending time with you. So incredibly inefficient. And under Sanders' plan, that wouldn't be an issue. Again, there would only be one insurer, and that's it. And they would set the rates. Now, speaking of rates, right? What would the rate for services be at? Well, under Sanders' Medicare for All bill, it would be the same as what Medicare rates are now. Okay. And it turns out that Medicare rates, and this will save us money, Medicare rates are actually lower than those charged by private insurance plans. Now, we don't quite know how much savings will happen. The CBO hasn't scored it, and Sanders hasn't come up with a vehicle yet to be able to pay for it. But he does assure us that that will be coming in a separate piece of legislation, and a lot of it will be focused on basically increasing taxes on the wealthiest Americans in order to help pay for this bill. Now, that said, it's likely that most people will see some sort of tax increase, but don't be afraid of that, okay? Because again, you will no longer be paying deductibles or health insurance premiums. And the amount of taxes you pay, for example, if you're somebody making $30,000 a year, you're not going to have a gigantic increase in your taxes, and you will actually save a lot of money. So now, of course, you're going to see right-wingers, people that are against this, and even corporate Democrats. They're going to attack this. They're going to attack this based on the cost. Hillary Clinton already calls this a pony. It's not a pony. It actually makes sense. And again, nearly every industrialized country already has a form of single payer. And look, some of their, to be fair, a lot of these other countries have a single payer system that's less comprehensive. Okay, if you want to pare back some of the cost, we can negotiate on some of the things that it covers. Unfortunately, that's kind of a way to get things done. But this is a first, this is putting this on the table. Bernie Sanders went with, let's go with the most progressive option and let's go from there. And I think that's a great strategy. Now, again, on the attacks, you're going to see a lot of these attacks. We've already seen a lot of these attacks because, number one, a lot of their donors, and these are from the politicians, these donors are health insurance companies. And number two, of course, they're attacking because it's going to end up mostly raising their taxes, the taxes of the super rich and the taxes of the donors. These people are willing to put profits over your health care and the health care of all Americans. So I got to tell you, pay attention to the facts. Do not fall for the propaganda. And some of that propaganda will be America's broke. We can't afford it. We absolutely can afford it. I mean, what we couldn't afford was 2 unfunded wars. What we couldn't afford is giant tax cuts for the richest 1% that are saving millions. We couldn't afford that, but we can afford this. So, and we will do this. Maybe not today. It's got no chance of passing through this Congress, but we will do this. The writing is on the wall. A single payer, Medicare for all, it is inevitable, and it is coming. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.